Let's talk now, though, to Jamie Jenkins, our favourite statistician and political commentator, of course. He's based in Wales, but his reach is everywhere. Jamie, very good morning to you.
Good morning, Mike. You all good?
Yeah, very well indeed. Very well indeed. Interested in what you've been saying lately about, particularly with regard to the vaccination for teenagers, which the government is now apparently saying that we should do, despite the fact that a few weeks ago they said we shouldn't do. A lot of the reasoning is being given as long COVID, and a lot of the people who are in favour of these vaccinations for 16 and 17-year-olds is suggesting that not only are they spreading the disease, but they may suffer badly from long COVID. I feel like long COVID is a bit of a shibboleth, and it's very, very difficult to pin down.
Well, Mike, I think one of the issues, I suppose, with long COVID is when you look at the number of symptoms that are linked to long COVID, it has a big overlap with a number of other conditions like mental health conditions. So the story, obviously, this morning is vaccination for kind of teenagers now and whether or not that goes even younger. I've just been crunching some of the numbers just to, let's probably start with the worst case outcome, I suppose, for youngsters and go beyond just 16 to 17-year-olds and look at death. So what we know from the ONS, Mike, across England and Wales, there's been 44 deaths across the country since the start of the pandemic, where COVID was mentioned on the death certificate for people up to the age of 19. Now, to put that 44 into some kind of context, there's 141,000 deaths overall. So it's a very, very small number. But you can dig into the data a little bit more and then look at NHS England's data, because they break things out a little bit more in terms of people who've died with a pre-existing medical condition or not. So when you do that, over 80% of those people who tragically died, obviously were young, had a pre-existing medical condition. Now, in terms of the vaccination rollout, Mike, they've already said that they will vaccinate even people down to the age of 12 who've got a pre-existing medical condition. So I think just in terms of the deaths, there's very little impact. And just to put that...
So you're talking really about half a dozen, aren't you, in the end?
Well, you're talking probably less than 10 since the start of the pandemic, Mike, of people who've died who haven't got a pre-existing medical condition but had COVID. Yeah. We don't know if it was COVID that killed them. And just to put that number into some kind of context, Mike, in the last week alone, so literally just the last week, we've had 82 deaths of people who are age 0 to 19 from all other causes. So, you know, people do die sadly, and it's a relatively low risk. So that's the first thing. Then the second bit is whether or not people get seriously ill or end up in hospital. Now, government issued some numbers last week, and we've talked in the past, Mike, about people who are going into hospital and they're coming into the hospital admissions data and they've tested positive on admission, but they didn't go in for COVID. So now we do know that 1 in 4 people who are going into hospital are going into hospital with COVID, but not because of it. We don't have an age breakdown on this one, Mike, which is a bit of a concern for me in terms of youngsters. Because I would imagine the younger people, it's going to be much higher than 1 in 4. So we've got a bit of a void there. But there's a study out today which is looking at kind of children who are catching it, because obviously it's not just the deaths and going into hospital. The concern is people catching the virus and then getting seriously ill, potentially having kind of long COVID, which is what you talked about. So what they've done is they've looked at some of the data using some of the symptoms that have been recorded. And most youngsters don't develop any symptoms at all. We know that, and which is why you see a lot of transmission but very few symptoms among some of these younger people. Yeah. And then what they've done is they've tracked the symptoms about 4 and 8 weeks later. So fewer than 1 in 20 people who had COVID, who were in the younger age group, had symptoms 4 weeks later, and fewer than 1 in 50 had symptoms 8 weeks later. Yeah. So, and they also found, Mike, there was no reports of kind of neurological symptoms, fits, seizures, etc. So if you go back to what the government was saying in the government advice a couple of weeks ago, is that there was minimal health benefit of offering the COVID vaccines to kind of younger people. I can't see what's changed with regards to the data. We've just gone through kind of the relative risk, which is relatively low. I think the problem you will have, Mike, if they do extend this, is we know that the government's kind of created this fear over the past year. Most of the adults have had a vaccine. So it's going to be a difficult choice for some of the parents, because some of the children, we know the mental health worry of COVID is in there. So some children may be worried about COVID, but when you look at the relative risk, it's relatively low.
Well, it is, but as I've said earlier to John Redwood, the problem for me is that we're not given the information in order to make that right decision, because in the end, we don't really know for sure whether there's any long-term effects if you vaccinate young children in particular, maybe even reasonably older teenagers as well. We don't really have absolute and utter conviction about the fact that nothing in terms of your fertility is not going to be affected. And I would say if I had a daughter of that age, I'd say, well, if there's any risk whatsoever that your fertility could be affected, and they can't guarantee that it won't be, then I wouldn't have it.
And therein lies the kind of the crux of the issue here, Mike, is that the younger you get, the less benefit you get from a vaccine, which is why if you just take the flu, for example, we know the flu is a deadly virus, and the JVCI, they vaccinate all the vulnerable groups, the kind of groups 1 to 9 as well for the flu.
Yeah.
They were the priority groups for the COVID vaccine, because obviously we knew that COVID was killing across society. People who were vulnerable were dying from it. We've just gone through the numbers. It's a very low risk of death, very low risk of kind of serious illness with regards to COVID. And you're right there, Mike. We still don't know the impact of the vaccine. No vaccine comes without a risk. And they say the younger you get, the less kind of benefit you get from a vaccine. I think what's kind of probably spooking the government at the moment is that we've seen this big drop in cases over the last month. We saw it in Scotland a bit earlier. And it does coincide, Mike, with kind of the schools closing, where you are seeing a lot of kind of households mixing there. And Nicola Sturgeon yesterday has come out and removed most of the restrictions in Scotland. So it's going to be a bit of a test now in Scotland, because the schools go back earlier there. I think they've probably been spooked that we've got some data that does show that if you have a vaccine, you're less likely to transmit the COVID. It didn't stop you getting it completely or passing it on, but it does reduce it significantly. So I think they're probably worried about COVID cases going up, generated by lots of teenagers. So that's probably maybe the reason behind the vaccine, is to stop transmission rather than any benefit to the teenagers.
But if transmission in schools is worse than it is elsewhere, but yet it doesn't actually cause a massive amount of harm, because all of the people who are transmitting it to one another are relatively young and therefore not really being damaged by it, then that won't stop just because people have had a vaccination, because if the effects are not that bad anyway, then they're not going to get any better particularly, but the spread might be the same.
No, you probably would get a little less spread, Mike, but then it comes back to that risk and benefit or part of the vaccine, because remember what the concern when they closed schools in the past was that children were transmitting it and catching it, didn't have any symptoms, didn't show any illness whatsoever. They would go home, infect somebody who's in the household, and somebody, they may end up in hospital and sadly die. But remember now, all the adults...
Yeah, but has that ever happened? I mean, I've not heard of a case that happened.
Yeah, well, it's all, just remember now, Mike, all the adults are vaccinated now. So even if that was happening, that it becomes less relevant now, because all the adults are vaccinated. So I think you're going back down this age group. I think you've really got to look at the data and think, is there a benefit to vaccinating the children versus the risk? What's changed in the last week? Only 2 weeks ago, the JVCI said there was minimal health benefits of doing this. What's changed? I haven't seen anything, Mike. So we've just seen constant U-turn after U-turn after U-turn. And it's just getting a bit concerning now.
Well, this is it. I mean, I'm not convinced at all that anything has changed. And I was rather concerned this morning to hear somebody from Imperial College, believe it or not, banging on about some study they'd done which showed that this is why we need to vaccinate teenagers. Well, I'm sorry, I'm not buying anything from Imperial College these days. Thanks very much.
Well, we've seen lots of these models from Imperial College, Mike, in the past, and Professor Neil Ferguson as well. And then you've got this counterbalance, and you're right. So I'm a bit, putting my stats head on, Mike. I've had to go scouring a lot of different websites to pull all these different numbers out today. I think you bang on. Why can't we just have the numbers put out there? People can make an informed decision on all of this. Have a proper debate, because you sometimes see, like, obviously you're kind of getting me on to talk about the numbers, Mike, but sometimes you just get shows kind of throwing things down the neck that children are kind of having long COVID. It's really bad, and all these scare stories come out. And
well, that's what I mean. I mean, we alone, and I don't say this because I want to pump up talk radio. I don't need to, but we ask the questions that people out there are asking. We don't ask the questions that we think government wants us to ask. We ask questions that the people want to know the answer to. I, for example, would love to know why certain people have an adverse reaction to the vaccine. There must be some form of data that can be collected on the people who have had a problem, because maybe there's some kind of common theme. Maybe there isn't. I don't know. If one of your children is epileptic, should you get advice on whether to get the vaccine? All of this stuff that we should be told, we're not being told.
No, true, Mike. And remember, just in terms of the kind of the deaths amongst these younger people that we just talked about, they're already getting the vaccine. So it's not a case of having a change. People who are vulnerable, who are young as well, they've been recommended to have the vaccine, and that rollout is happening at the moment. So I just think this U-turn and potentially doing kind of teenagers in terms of doing it, where does it stop then, Mike? Because if you start vaccinating 16, 17-year-olds, they'll probably start saying, well, we should vaccinate 15-year-olds.
Oh, they will. No, there's no doubt, because that's exactly how they work. This is their MO. They pretend that they're going to start doing something for one period of time, and then the next period moves, and then the next period. You know, remember when we started this back in December of last year, when people started getting vaccinated? Supposedly, it was 15 million jabs to freedom. That was the headline. It was going to be all over by February. It was all going to be just the vulnerable people that needed to be vaccinated, and the rest of us could return to normal. Well, that hasn't happened.
No, Mike, and you can see now in England, I think Wales is slightly ahead of the game with England on the vaccine rollout. But in England now we've got these kind of kebabs for jabs and all these different kind of things that are coming out there. And again, even for some of the younger people, they're obviously making some informed decisions themselves. They're looking at the data. We know the risk is relatively lower, and they're trying to get more and more people to have the vaccine. Yeah. But we don't do the same for flu, Mike. We know people die from flu. People who are vulnerable get vaccinated for the flu.
No, I know a lot of younger people who are now getting vaccinated because they don't want to be locked out of nightclubs, and they're buying the propaganda.
And therein lies another U-turn, Mike. We've had government ministers coming out saying that we're not going to introduce vaccine passports, and then what comes out? They're going to introduce vaccine passports. We've spoken about this, so Mike, it probably is more of a coercion tactic to try and get people to kind of take the jab so that they can go to nightclubs. And then this story coming out as well this morning about, can you wear masks in nightclubs in Scotland? I know you're talking about it later on in the show.
Come on, really?
Who's running the country at the moment, Mike? It just seems to be carnage out there at the moment.
It really is absolutely ridiculous. Jamie, great to talk to you. Thanks very much indeed. Jamie Jenkins, independent statistician, political commentator, of course, as well, a man that cuts right to the heart of the matter.